Today, more than ever, healthcare leaders must address a multitude of complex and intertwined challenges. A short list includes attracting and retaining talent, enhancing care quality, improving the patient experience, and promoting clinician well-being. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle with AHA Communications. Supporting clinician well-being is at the forefront of workforce strategies across hospitals and health systems. It makes sense. Clinicians need to be able to perform at the top of their game to provide the best patient experience, contribute to the health of the organization, and establish a positive, long-lasting impact on their work lives. Join us to hear how Kaiser Permanente and Mass General Brigham are using innovative workforce approaches, including performance coaching, to give clinicians the resources and skills needed to thrive professionally and personally. Today's podcast is brought to you by Valor Performance.
Hi, everyone. I'm Elisa Arispaco-Chaga, Vice President of Clinical Affairs and Workforce with the American Hospital Association. The workforce challenges facing the healthcare field have emphasized the importance of addressing well-being at a system level and building a workplace culture that supports it. With me today, I have leaders who are doing exactly that. Joining me today are Dr. Mary Juarez, Chief Wellness Officer with Kaiser Permanente, Washington Permanente Medical Group, and Dr. Lee Park, Chief Patient Experience Officer with Mass General Brigham, and Sarah Milby, CEO and founder of Valor Performance, to share their experiences in building organizational well-being and supporting their teams. So let me start here to sort of set the stage with all of you for our discussion. As you all have probably heard me say, workforce challenges are not new to healthcare. COVID really just put a highlighter pen on some of the challenges that we faced. The field continues to look for new ways to address both the challenge of keeping and helping their team members thrive. So Dr. Juarez and Dr. Park, I'm going to ask you, and Mary, I'm going to start with you. What are you seeing as the biggest challenge across the field that you really have to make a priority to be able to move forward with your workforce?
Thanks for that question, and thanks so much for having us today. I do think one of the biggest challenges across healthcare right now is really maintaining an engaged and energized workforce in the face of competing priorities. And so looking at the issue holistically, and that really means equipping individuals, which we've sort of done in the past, looking at healthcare worker well-being, but also teams, organizations, and really the system as a whole to embrace change and different ways of thinking around how we might deliver high quality care while maintaining meaning in medicine. And that may take some innovative strategies to address the healthcare worker shortage.
Absolutely. And Lee, your thoughts?
So I think COVID, we all haven't been through a global pandemic. So there was that. I think there were a lot of changes through COVID that we weren't necessarily anticipating. So there is a lot of workforce shortages, not just among physicians, but among support staff. I think healthcare has faced a lot of financial challenges that we haven't faced in the past. And I think COVID globally actually was a very challenging situation for patients, for providers, for everyone. We have a lot of challenges with how patients their conduct in our offices and things. And those are things we hadn't faced before. We also, had some delays in care. The emergency rooms, are overflowing. So I think that COVID might have exacerbated some things, but it also created some new challenges for us that we hadn't faced in the past. And, that has made well-being really tough in the last couple of years, I think, for everyone.
Absolutely. I think we have seen a real splitting of what that priority list looks like into three really strong priorities around supporting both the team, making sure that we can keep everyone safe, and how to best do all of that with the financial pressures that hospitals face. So I really appreciate your setting the stage for us. And I think this is something that the next question I'm going to ask, and Lee, I'll start with you, because I think it's so important to highlight and really underscore the connection between the well-being of your clinical team in particular and the impact on the patient experience and outcomes, as well as the entire culture of the organization. We want people to want to come to work. And honestly, I've never met a clinician or anyone in healthcare who didn't want to do their very best for their patients. But how do you see all of these factors that are swirling really impacting that connection?
I mean, I think at the end of the day, most of us went into healthcare so we could help patients, right? In order to help patients, we want to do that at the best of our ability. And that's really when we are personally, professionally fulfilled and we're not burnt out. There are a lot of factors that go into that. So some of it is like me personally, where am I? There are organizational factors that go into it. There are systemic, factors like larger healthcare items. So I think the link is just, I mean, it seems like it's not hard to put together. Like if you're doing well, no matter what you're doing, whether that's, in your personal life or your professional life or whatever, you're going to be doing better in that space. And there are a lot of links to workforce well-being, professional fulfillment and burnout to, better quality outcomes, let people making less mistakes and things like that. But at the end of the day, it just seems like we want to make sure that our workforce feels like we care about them and so that they can take the best care of patients that they can, because at the end that's our ultimate goal, I think, for everyone.
Absolutely. Mary, from your perspective.
Yeah, I absolutely agree. I think, studies have really shown that patient experience and quality suffer when clinicians are burned out or lack professional fulfillment and meaning in their work. And so, however, we can enable that is important. And we know it's all connected. We need to have a culture that's high in trust and community and collegiality in order to really enable all clinicians to take the best care of our patients.
Absolutely. And Sarah, let me ask you to jump in here because I know that one of the things we have spent at the AHA a lot of time helping, particularly clinical leaders, but others think about is really, to some extent, adopting an athlete's mindset towards their career, that this is not even a marathon. This is one of those marathons where you run, thousands of miles instead of 26. It is a career in healthcare needs to be sustainable, and to do that effectively, you have to address some of these challenges. And I know your work has focused on leadership and performance coaching and how you do that. And you've taken a lot of lessons from the athletic world. And I'd love for you to tell us a little bit about how that works and how it's different from other tools to develop your team.
Sure, happy to. I think you hit on one of my favorite words around sustainability. And so for Valor, we think a lot about sustainable high performance. And it's really important to acknowledge that at least the coaching with Valor, it is a strategy to reward, invest, value, and develop rising leaders. It's a way to build leadership capacity. It's not a punitive one. And look, the best of the best athletes have coaches in their corner. And we just bring a lot of those principles to reward, invest, and develop rising leaders in various different arenas of high performance. Our work within healthcare is a key strategy to help ensure that some of the leaders are also getting that energy management, having a sounding board, especially third party. There's the psychological safety where you're able to actually discuss things to navigate choices and priorities, navigate all the competing demands on people's schedules. And because it's also digital, it's a way that people can do it anytime, anywhere to accommodate just the crazy schedules that people have. So that's the work that we do. And we have the pleasure of, you think about nodes of change you hit on, and Mary hit on system, organization, team, individual. And we believe that you really do need to support the individuals as they navigate all the changes, as well as critical nodes of teams like leaders that are going to have a ripple effect and eventually cascade across the organization and culture.
Couldn't agree more. I think there's a lot of value in really helping leaders have that extra bandwidth and gas in the tank to really start to make the change they need. But Mary, let me turn to you and ask you, how does performance coaching fit into the work you're doing in your organization to really improve the entire organization's well-being?
Yeah, our strategy has included building coalitions of well-being collaborators and cultivating a culture of well-being. I think, as Lee mentioned previously, COVID really brought particular challenges. And one of the things that we found throughout was that, in particular, our women clinicians were particularly impacted and really wanted to focus on, as Sarah said, building up leaders in that particular group within the organization. So we did partner with Valor to focus on a cohort of women leaders, women with leadership potential, and really focus on that. And performance coaching in general really equips individuals to grow themselves. And as I mentioned, community and collegiality, equipping wellness centered leadership. And that's what we found with partnering with Valor and coaching.
That's great. And Dr. Park, tell me a little bit about how you've used performance coaching in your organization.
So I think we used it a little differently. We weren't as focused on leaders specifically, although we have the same data that shows, female physicians have higher rates of burnout and lower professional fulfillment, and that's been true for a number of years. We use the Stanford model in terms of the three areas of well-being, so cultural wellness, efficiency of practice, and personal resilience. So coaching really fell into the personal resilience bucket. And I just want to say it's like one piece of like a larger thing that has to happen. It can't just be coaching. We looked at, what our sites had done successfully, and coaching was one of those things. I think the goal is to really help physicians who haven't really been trained on personal resilience. Like we actually are very resilient people to get through like med school and residency and everything else. Like you have to have a pretty high level there, but I think often, as physicians, we don't have a ton of self-compassion, right? We're not sure how to navigate leadership. There are these things that we haven't necessarily been trained to do. So we looked at coaching as a way to sort of shore up and support a number of people that way. And the way that we approached it was we sort of let it up to the person and the coach to make the goal. So it wasn't specifically about leadership, but it could have been like, hey, I need to find more time to see my kids. It could have been, hey, I need to figure out how to like do this academic promotion, or hey, I just got into this leadership, position. Like, how do I build up my team? We're still gathering data on exactly how people have used it. And it may be different across our AMCs versus the community hospitals. But again, it's like one component of a number of items that hopefully when you put together, it addresses a number of things, because well-being isn't, we don't want people to think like, oh, I have to be personally resilient and that's how I'm going to, be well. Like there are other things that we have to do as a system in the practices and, other components to that. But it's one piece where we felt like there's good support. There's some evidence on this, that coaching can help some of these areas. And it's one of the things that we wanted to try and pilot. So we're in a pilot phase with this. We're gathering some information on, what people used it for, and also, does it change outcomes, in terms of professional fulfillment, burnout, and intent to leave. So we'll see where that lands, but that's where it fit in for us.
I'm really glad you emphasized that point, because it is one piece. It's the groundwork that can help create that space for being able to address what are the efficiencies we can bring, because the people doing the work are the ones who can help you identify that. And how do you think about, really those system level activities that can make it a more fulfilling place to work? Well, if you don't have enough time to, go to the bathroom in a day, you're not going to have time to think of those things. Mary, anything you want to add from your perspective? And then Sarah, I'm going to ask you to jump in as well as what you've seen across the country.
Yeah, absolutely. I would agree with Lee. I think, it is one component. And, we also use the Stanford professional fulfillment approach. And we know that this is a national movement for a reason, the National Academy of Medicine. And there's so much attention. Our Surgeon General as well has addressed this issue with an advisory. And so it really is an approach that we can invest in at the organization, at the national level, that individual patients even can really address this as well, because it impacts them. So I think it is important to recognize that it is one component. As Lee said, it's not just on the individual, but it is something that we also want to support the individual as we move towards making those systemic changes.
Thanks so much. Sarah, you get the opportunity to see at a national level with the multiple organizations that you work with. How do you see people using performance coaching to really kickstart and drive forward their organizational efforts?
Yes, and a couple of things I want to just build on that Lee and Mary shared as well. I completely agree. Coaching needs to be part of a suite of solutions. It is not a panacea, because it is a systemic and sometimes organizational issues that need to change. And you need to invest in the talent that is navigating those environments. And so you cannot wait for everything to be resolved at the system level to support the workforce. And the beauty of having a tailored solution, as Lee mentioned, where one individual is going to work on something different from the next individual, but it also be scalable, like with MGB, where we can go across MGB wide, is a benefit, and I think a huge value that we have the privilege of being able to see different systems, hospitals, and health systems across the country. A couple things that we found in our data, I mean, pertinent to this conversation, we have seen in our data a reduction. Many of our organizations also leverage Press Ganey, for instance. And so we have seen and correlated to a reduction in intent to leave. We've also started to ingest some of our own information and data where, Elisa, I know you're privy to cognitive load and some of the NASA task index work. And we've incorporated that into some of the Valor experience to see at baseline, midpoint, and final, how are people experiencing their work? And no one is going to be surprised to hear the high mental cognitive load of clinicians. And we see an impact in people's confidence to navigate, confidence and coping mechanisms to navigate that mental cognitive load, and better behaviors in their response. Not as much like anger in response, for instance, is one of the data points that we found. So we're seeing some really promising outcomes with a lot of our organizations. I think the point that I feel very passionate about is we often are talking about the transformation that has to happen in healthcare. And some of that we just need to acknowledge needs to happen at the individual level. And helping people adapt to change is going to be a critical strategy in actually executing on a lot of broader strategies for healthcare transformation.
Thanks so much, Sarah. And I think there's, really starting with what can we do to support the teams individually so that they can make a healthcare system that really works for their patients, for the work that they're doing. Mary and Lee, I'm going to ask, as you've been doing this work, what guidance would you give your colleagues in incorporating performance coaching, in thinking about their well-being and workforce strategies, in supporting their team members to be able to move forward? And Mary, let me start with you of, what if one of your colleagues called you, what would you say? What advice would you give them?
I think it's so important to recognize that this is a proven investment in your people. I think, as Lee mentioned, there's a lot of competing priorities right now at organizations, and finances and resources is definitely one of them, a reality. But our people are our greatest asset, and especially in the healthcare workforce situation right now. And so it really is an investment in people, and that expands to their teams. If we're investing in individuals, whether it be around their leadership behaviors or around their individual resiliency, it makes a big difference to the organization as a whole.
And Lee?
I would say a few things. One, as we kind of discussed, like there's not going to be one intervention that will solve all problems. So, making sure that coaching is like a piece of something else that's going on. For coaching itself, I think the valuable lessons for us was, it's not a one size fits all. And so we actually did a pilot with a couple of different arms. We did some group coaching, we did the performance coaching, and then we actually have faculty coaching as well. So we're trying to look at, how do those three different kinds of coaching work or not work. We actually pivoted away from group coaching because it wasn't successful for a number of reasons. And then I think talking to other organizations, there's so many people who are trying to do this, and there's so many people that we can learn from. So we talked to a number of folks, in terms of like, how did you do it? Did this work for you? And every organization is going to have its own nuances. Some of us are bigger than others. We have like academics, some people don't, but there's a lot of learning that you can do, from the group, where you don't have to reinvent the wheel. And then I think the other thing is just thinking through like, what are you measuring and what is the goal and the problem that you're looking at, so that you are kind of moving towards something. I think often in well-being, things can feel very nebulous as to, what are we trying to impact, and just making sure, to Sarah's point, like we're looking at professional fulfillment, burnout, and intent to leave, and thinking through like, how do these interventions or, changes impact some of those things? Because again, just getting it back to like the patient, at the end of the day, what we're trying to do is keep our workforce well so that we can take, better care of patients and have better patient outcomes. And so just kind of making sure that we keep an eye on the prize and, really think through what the goals are so that we're all moving towards the same thing. As I said, I think sometimes in the past, things have been kind of nebulous. And so making sure we know what we're aiming for. So I would say like it has been great in terms of, the coaching pilots that we've been doing. We're still learning, and, we really hope that this is something that can be sustainable, where people feel like we're investing in them and, can help us take better care of patients.
Thanks so much for that. And Sarah, let me close with you and just ask, when people call you up and say, okay, can you fix this doc for me? Or can you fix my dysfunctional team? What is the advice you give in terms of where it fits in the grand scheme of your work?
I have many responses to that question if someone was going to lob that over. So a couple things. One is, and it actually builds from what Lee was saying, we like to be really thoughtful on the leading indicators and lagging indicators as it relates to measurement and metrics of success. And again, coaching, third-party coaching, scalable coaching, the digital components that people do self-directed, you have to have people who are opting into that experience. It cannot be thrust upon, it cannot be forced. And so now, look, we're often oversubscribed when we've rolled out with partners because there is such a demand for this type of offering. That said, this is not a we will solve the problem, children. This is let's invest in the future of our organization by investing in the development of our rising leaders. And you won't be surprised that not only do we get positive information from the individual who feedback from the individual who receives coaching, but it is then validated by when we've done other 360s to get, and how is the team seeing the impact of that individual? So we do have impact on how people are showing up and some of their behaviors, absolutely. But the framing matters, communication, and making sure, and this is something that we're pretty hands-on with a lot of our partners, that it is framed as A, congratulations because we're investing in you, and B, we want you to see this as a support mechanism for your personal and professional growth. This is not, we're really worried about you. Frankly, we've been discussing this a lot, behind your back. This is much more of an investment. And that's why, by the way, we have over 90% of participants say they feel more valued by their organization when they've received Valor.
Can I just add one thing? I do think it's very important, as Sarah said, we framed our coaching program as this is not remediation at all. And we've very separated that out. We thought it was really important to do that. And the nominations came from leadership the way that we did it, again, just as a recognition thing. But I do think you need to be very careful about how you frame coaching, because a lot of people, when we first started, were like, wait, did I do something wrong? Why am I, getting put into this program? And we wanted to make sure we kept it out of the remediation and that, bucket, and very much into the hey, this is for your growth and your leadership, or however you want to do it. And I think that's really important when people are thinking about any kind of coaching program.
Yeah, we took that approach as well. And I think it's important also because, and saying what coaching is and what coaching is not, I think there's a lot of misconception around that as well. So I think if you are implementing a program, to really define that and make sure that there's understanding broadly around how coaching can be beneficial.
I think that also, sorry, I'm going to build on that because it also goes to this word trust again. And we love when some of our partners have internal coaches, and there's value in having the psychological safety of a third party who also can cross pollinate from other organizations as well. And there's such value in that from just the innovation, the ahas that can be generated. But I just wanted to double click on that word trust that we, of course, want in our organizations. And we need to acknowledge that sometimes people need that safe space to have conversations about what they're navigating at work and in life that a well-trained and professional coach can provide.
Absolutely. Wonderful conversation. And I really appreciate the work that you all have done and continue to do to frame this as the positive that it is. As you said earlier, Sarah, no professional athlete would think to go to any competition without their coach and without their support team. And I'm glad to hear that our clinical teams and our colleagues understand the value that that can bring to their own experience. So Mary, Lee, Sarah, thank you so much for joining me today and sharing your insights and your thoughts and the work that you're doing. To learn more about Valor Performance and the work that Sarah is able to do with her team, please visit their website at www.valorperform.com/healthcare. And again, just my sincere thanks for all the great work that you all do.